Hi, my name's Maddie, and this is Marmalade. And like 30 to 60% of cats worldwide, Marmalade is overweight. Marmalade is 12 years old and currently weighs 6.5 kilos, with a body condition score of 7, which approximates to 25% excess body weight, meaning her ideal weight should be about 4.875 kilos. As a geriatric cat, Marmalade may already be experiencing age-related subclinical disease, such as early-stage chronic kidney disease. Obesity as well can significantly increase the risk of diabetes, cardiomyopathies, cancer, urinary and renal disease, liver disease, osteoarthritis, as well as notably reducing life expectancy. As weight loss can delay disease onset, we are instituting a weight loss diet that considers her needs as both a geriatric and overweight cat. The goal of many commercial weight loss diets is to increase protein and fibre intake while reducing fat content in order to lower the nutrient to calorie ratio while maintaining satiety. Caloric restriction is the only effective method of weight loss in cats. However, over-restriction can result in protein deficiency, loss of lean body mass, fatty degeneration of the liver, as well as essential nutrient deficiencies. This diet was formulated using Pet Diet Designer, as it is easy to use and offers a wide range of feeds to choose from. Overall, this diet provides just under 174 grams per day, with about 80% moisture content, the benefit of which is to help maintain satiety during caloric restriction and ensure Marmalade stays hydrated, as geriatric cats are less sensitive to thirst and prone to dehydration. A limitation of the PDD software is that it uses NRC guidelines which do not adequately differentiate between adult and geriatric nutrient requirements. As maintenance energy requirements decrease with age, this software tends to overestimate geriatric daily energy needs, and so instead, a research-based, age-adjusted estimate of Marmalade's MER of 182 kilocalories per day was used. PDD also uses a 50% caloric restriction for weight loss, which has been discredited for use in geriatric cats as it can cause protein deficiency and irreversible loss of LBM. Instead, this diet uses an 80% caloric restriction to achieve an optimal 0.1% body weight loss per week and resulted in a final energy requirement of 145.8 kilocalories per day, which this diet provides. Cats are obligate carnivores and have a uniquely high dietary protein requirement to support both protein turnover and continuous gluconeogenesis. In regular adult cat diets, protein tends to make up about 35% DM. However, in weight loss diets, increasing the proportion of protein from 35 to 45% DM has been shown to halve LBM loss and increase fat loss by 10%. In this diet, a more moderate protein increase to 40% was chosen, as a protein restriction to less than 41% DM has been shown to be the most effective method of delaying early-stage chronic kidney disease progression. On a DM basis, this diet provides 7.8 grams of pork liver to help meet zinc and vitamin A requirements, 3.9 grams of chicken liver to help meet fat, selenium, and vitamin B2 to 12 requirements, and 2.3 grams of tuna to help balance omega-3 and 6 fatty acids. 0.1 grams of taurine powder was added as well to help meet Marmalade's taurine requirement, which is essential for cats as they cannot synthesize adequate taurine themselves and rely on it for bile acid conjugation. This diet also provides 15% fiber, which in addition to protein aims to improve satiety during caloric restriction. 1.3 grams of wheat bran was included to increase fiber content without oversupplying carbohydrates. 4.3, 3.7, and 2.5 grams of broccoli, carrot, and pumpkin were included as a low energy source of fiber, moisture, and overall DMI. These vegetables contain a significant amount of vitamin E and selenium, which are important antioxidants that can counteract the oxidative damage, particularly to joints, that accompanies obesity. They also provide sufficient vitamin K and are relatively low in phosphorus, which is an important consideration for cats at risk of developing CKD. 4.7 grams of flaxseed and 3.7 grams of corn flour was also included to help meet overall fat and energy requirements above the protein already provided in this diet. This diet meets the FEDIAF amino acid requirements and does not exceed limits where they are known. During weight loss, fat reserves are mobilized and broken down in the liver to fatty acids to be used as a substrate for gluconeogenesis. As methionine and cysteine are limiting reagents of this metabolism, they are particularly important in weight loss diets in order to avoid diseases such as hepatic lipidosis, and were therefore included above the basic nutrient requirement level. Fat, fatty acids, and vitamins were all included above the minimum FEDIAF requirement without exceeding maximum levels. More than the minimum fat, vitamin A, B, D, and E requirements were included, as geriatric cats have been shown to have a decreased ability to digest fat, as well as fat and water-soluble vitamins. And as deficiencies can cause skin, coat, neural, and gastric dysfunction, it is important that this diet provides enough. An important ratio in cat nutrition is EPA to DHA, which in this diet is 0.16 to 1, which is within NRC guidelines. This diet was formulated to meet the minimum mineral requirements without exceeding maximum safe levels. 0.065 grams of kelp powder was included to meet the minimum iodine requirement, as iodine deficiency has been tied to feline hypothyroidism, which commonly affects middle to old age cats. 0.6 grams of calcium carbonate powder was also included to meet minimum calcium requirements and provided a calcium to phosphorus ratio of 1.18 to 1, which falls within NRC guidelines. Insufficient dietary calcium can lead to hypercalcemia, particularly if the animal has CKD. A moderate phosphorus restriction was also included, as this has been shown to delay the rate of CKD progression. While this diet is balanced and tailored to her current health needs, it is important to continuously monitor her health and body weight in order to make any adjustments that may be needed as she loses weight.